Go ahead.
Thank you to you both and all of your officials, both at the table and beyond, for being here. I very much appreciate it. Many questions, so we're going to dive right in. This past weekend, I had a town hall in my constituency, and what struck me was the number of people wanted to talk about healthcare and the importance of that as an absolute priority. Their focus was on high quality, accessible healthcare. They specifically wanted to see shorter wait times, and that was a very important focus for them. They did want better value for money. There's a perception that there's a lot of money already in the system, and feel like that we don't always necessarily get good value for that. But they really did want to focus on the human side of things. The one piece, the quote that struck me was I want to see our healthcare system humanized. I want to see you put the patient first. And so you'd made some comments about that earlier, but I just wanted to share that with you as Minister and your Associate Minister and your deputies, just to hear that's the focus that people would like us to bring. So I'll just give you a couple of moments if you have some specific information on wait times, specifically if there are initiatives in terms of reducing wait times that I can report back to my constituents.
Yes. Thank you very much, Madam Chair, and to the member for the question. Reducing wait times is certainly a priority for us and for all Albertans, I would assert. Alberta is a top-performing province on wait times for hip fracture surgery, bypass surgery, radiation therapy. But we certainly know there's other work to be done in other areas, and government is working with AHS to improve access to health services, including better management of folks who are in the queue for surgeries using specific wait time targets and reallocating OR time according to the areas of greatest need. And I know sometimes that can be frustrating if you've been waiting for a surgery and you find out that you've been bumped because somebody with cancer is at the top of the list. But I think once people talk about if you were diagnosed with cancer, the urgency, people understand it. It's frustrating though if you're waiting and you're in pain in particular. So because of that, we've through this AHS will be able to invest approximately $40 million in targeted investments to reduce wait time, including addressing backlog in out-of-window cancer surgeries, zone-specific investment in cardiac surgery, hip and knee replacements, and other orthopedic surgery, and urgent cataract surgeries and other quality improvement initiatives. So we have an increased investment in this budget of $40 million to help address that.
Thank you very much. And the specific concern as well that was expressed to me was people getting sicker while they're on the wait list, that perhaps not only reduce their quality of life but also increase costs going forward. So I'll just put that out there. I would like to move on then, just some specific questions about your department itself. Do you have any data you can share on the number of positions that have been vacant in your department, the Alberta Health, that have been vacant for more than 6 months? Do we have that data readily available, or if not, could it be tabled?
We'll work to table that.
Thank you. And I'll ask the same question, please, about AHS. If we have, how many positions in AHS have been vacant for more than 6 months? And if you don't have that data handy, would appreciate if you could table that.
I definitely don't have that handy. I'll do my best to find some information that we can share around that. As we've talked about in the House, obviously we want to ensure that all necessary positions are filled when there are vacancies, particularly that are achieved through retirements or other moves. We are examining every position to ensure that it's the right place to fill that position rather than just doing it rote. We know that it's important for us to strike the right outcomes for patients and also to achieve that path to balance. So we'll get some information that we can table at a later date.
I'll move on to the personal health record, which you referred to on page 81. We talked about it earlier, but and you used your school test example, and I think that was a good example.
Thank you.
It was interesting. It just so happened I had my annual physical with my GP here last week during Constituent Week, and I'm fine. I'm sure you had glad to know that. But I asked him, so from his perspective, what's happening? Is there a project underway? And I said exactly that. So if you run some standard blood work and I'm interested in what my cholesterol level happens to be, will I be able to go online just like I can go online at my bank and see this information? And so that's my question to you, Madam Minister, through the chair. Is that system we're talking about AHS only? Is this going to be extended out to GPs? Because I think that, especially for the investment we're making, would be the expectation of Albertans, that our health information, regardless of where it comes from, that sort of information would be available to us online. Is that what we're doing here?
Thank you very much, Madam Chair, and to the member for the question. And certainly that is the ultimate goal, is for everyone to have the right information to inform them around where they're at in their health journey. And the personal health record will enable Albertans to manage their health and well-being, providing them with a secure place to store a copy of their health information and interact with the health system digitally in one place. Making the platform available with mobile devices has been a real priority for me. I think this started a few years ago, before mobile devices were as dominant. I imagine most of us have two on us at most times, and by the end of 2018 the platform will be ready to roll out to the public. But obviously we'll start with whatever information is most easily able to integrate, and then we'll expand it for other physicians. As we mentioned, currently there's 1,300 different systems incorporating NetCare and information that's available on NetCare, which often our family physicians will put some of their own information to try to interface with it. But NetCare, I believe, right now is focused mostly around acute care and testing that's done more centralized. Because that's what's easiest to access right now.
And I appreciate that. And I have come from an IT world, so I do appreciate the complexity. And I recognize this is a particularly complex area when we're dealing with privacy, and there's a lot of complexity. But I think Albertans have an expectation that it's our job as legislators and as ultimately the government in the broadest sense to manage that complexity on their behalf.
Yes.
And so they just see healthcare. They don't really know that their GP is not part of AHS, and they don't frankly care. And especially as we focus, and should focus, not just on acute care, and I will just say that I think our acute care system is among the best in the world, and in certain areas we are the best in the world, and there's a lot to be proud of there. But a focus on wellness and an ability for Albertans to manage their own health care, I think should start and focus in PCNs, should focus with your primary care providers. So do we have a pathway with a timeline that's going to get us to a place when I go to my GP and he orders some tests and I will be able to go online and look up those tests? That's really the fairly direct question is, when are we going to roll GPs into this?
So the short answer is yes. The longer answer is over the next 5 to 6 years will be the full CIS rollout, and it will allow AHS to create a single electronic health record for every single Albertan, ensuring that AHS providers have access to the same information. So that single source of information will, as you mentioned, support team-based care, and the easiest information in the first stage will be to take the information that's available through AHS and import it into our own records. In terms of the individual doctor's offices, for the early stages, it will likely be that some of us need to, when we're with our physicians, say, so what medications am I on? And then we can enter that information ourselves, because having that interface won't necessarily be able to integrate it automatically, but we certainly can take a role to put that information into our record that we keep as patients as well. So we're continuing to expand Alberta NetCare to a secure online tool that currently provides over 60,000 registered health providers. These are many of the health providers in the community, with patient information to support their decision making in point of care, and NetCare e-referral projects are another piece too. I know that when I was referred for a surgery on my wrist a few years ago, I didn't know what the average wait was to see that type of plastics surgeon. I didn't know if it was reasonable to wait for a year or 6 months or 3 months to be in the queue, and having information around ensuring that the referral went through, that you are in the average wait time, because it wasn't an emergency.
And I'm sorry, I apologize. I hate to cut you off.
Continue, please.
We're very short on time here. So I'm going to move to the dementia strategy. And this is, some of these are questions that have come directly to my constituency office from my constituents that I've committed to pass along. And there's a great deal of frustration with the specifics of what I would respectfully say feels like a lot of re-announcements around what you've called the dementia strategy. And so there's a great deal of frustration. One of the specific questions is, what are you doing to address the 2 to 3 year wait list for dementia care? My constituent says some people die before they have AHS care facility support. Comparing that to cancer, certainly somebody would not be asked to wait. But is it because this is horrible disease, has no cure, no hope? It seems like the government thinks waiting 2 to 3 years for AHS support is appropriate. She says this is a travesty. What are you doing specifically to address that wait list issue within dementia care?
Yeah, and thank you for the question, and I'll start by saying no to the first part of the question around, is this because there isn't a cure currently? Not at all. There is sort of a four-pronged approach. Again, the expecting outcomes are understanding the impacts of dementia, supporting Albertans and their caregivers who are living with dementia, timely diagnosis, and then treatment management throughout the continuum of care. Obviously, when the condition is at its most extreme stages, some type of care facility is usually the next step, and that's one of the reasons why we have really prioritized long-term care and dementia care spaces in the beginning of our term, to ensure that we have the right mix and the right volume, to be frank, of dementia care spaces. The numbers continue to grow, and we've also worked to expand that First Link program as early interventions. Part of, and I understand that the beginning of your question was, it seems like there's a lot of strategies being rolled up into, or a lot of different components being rolled up into one strategy. And to be very frank, that is part of this, because dementia isn't something that just started when we started work on the strategy. It's something that our communities have been dealing with for generations. And yes, the numbers are getting higher, and the acuity levels, sometimes patients are living longer with more severe dementia. But this is about taking a number of different actions and making sure that we're intentional about how those actions actually help fulfill the goals of the strategy.
Yeah, and I've got to say, from the community level, there is a lot of frustration. There doesn't feel like there's certainly enough money going into it or enough focus. So I would really encourage you, please, to double down on that. You've said the First Link program funding. Just a quick yes or no, is that going to be enhanced and supported into 2019 and beyond? Is that?
My understanding is it's $1.95 million for early intervention programs to connect patients, and that's already being
That is the first
allocated.
Okay,
yes.
Thank you. What is the plan for funding? Is there a plan for funding of the dementia-friendly community pilot project? Is that
For a specific building you're referring to?
Well, there's something called the Dementia-Friendly Community Pilot Project. I believe it's in Calgary.
Yeah, we'll have to get back
Thank
to
you
you
very
on,
much. I
on the
appreciate
details
that.
for that specific project. My apologies.
All right. What portion of the funding for implementation of the Alberta Dementia Strategy is going to be spent around awareness and reducing stigma, which prevents people potentially from receiving a diagnosis?
So interesting, because when I think about reducing stigma, I often think about stigma that patients and their family members have talked to me about, their reluctance to be in community when they know they have dementia because they're worried about how people will interact with them. But the flip side around stigma around being afraid to even get a diagnosis is thank you for highlighting that complexity. It is one of the four pillars, is really around increasing understanding of impact of dementia and reducing that stigma for family members and individuals. One of the women I spoke with in Calgary not that long ago talked about how they made cards for when they go out with their dad, and they say, "Hi, this is," I think his name was Brian, I can't remember exactly. He's living with dementia. Thank you for your patience and understanding when you're talking with him, to help him have some of the tools to feel confident in engaging in the community.
Yeah, thank you. I'd certainly encourage you to focus on stigma reduction, and I think that is a very wise investment and not a huge cost either. Is there any funding specifically towards increasing the skills and knowledge of dementia within the broader workforce, and also specifically within the dementia workforce itself? How much professional development is contemplated specifically around awareness of dementia and how to address it?
Yeah, thank you very much for the question. This is definitely something we've talked a lot about with the the Alzheimer's Society of Alberta, and with AHS as well. This is one of the areas within the strategic clinical networks as well, that there is a specific pillar connected to dementia care, and this is one of the outcomes that they're certainly focused on.
Thank you very much. I'm going to try to go quickly through the next couple here. So some of the feedback I've heard is that there's a clear need for modernization of policies around home care supports to ensure they reflect the needs of the individual and not the needs of the system. And this is something I've observed more broadly in government, but in healthcare in particular. And that, I think, ties into where a patient moves from community care to hospital, continuing care, home care, or even palliative care, to ensure that there's a seamless transition. I've heard a lot of feedback that people feel like they fall between the cracks, or they kind of fall off a cliff, where a system is focused on itself, not necessarily thinking about what happens to a patient either before it enters that particular part of the system or where they go in the next step in their journey. How much work is underway to knit those things together in a way that's seamless from a patient's perspective?
Yeah, and thank you very much for the question. With the increased investment in community-based care, and as we mentioned, 19% specifically, I believe it was, in relation to 19.5 increase in home care. This is a growing area of need, and also a growing area of increased members of the workforce as well. And it's interesting when you talk to individuals who work in home care, it's incredibly fulfilling. It's also really challenging because you're not in a standardized work environment. You're in somebody's home. And sometimes home care nurses talk to me about things like pets, create a whole new dimension when you're talking about occupational health and safety. So increasing funds for training and education, and having more seamless integrations. Often home care offices in rural Alberta in particular, but sometimes in urban centers, are in the acute care facility itself. So the home care workers get to know the patient when they're in hospital, and get to know the family when they're in hospital before they go back home, and develop their care plans then. So this is definitely something that's positive.
And apologies, we have such a short time, so I'm just going to move on to my next topic, if that's all right, and I think this is a question for the Associate Minister. Licensing around, in particular, addiction treatment facilities. One of the great challenges that we face in dealing with the opioid crisis, which and it is absolutely a crisis, there are organizations that are accredited by very credible organizations like Accreditation Canada, and those organizations provide tremendous services. But I was very surprised to learn that there are no rules that prevent anyone from hanging a shingle and calling themselves quote-unquote addiction treatment. We have had some incidents in Sundre I can think of in particular not that long ago where there was a very unfortunate outcome. And I asked this in the House in December, and the word I heard in response was a licensing regime is coming, quote, soon. That is reiterating a commitment that was made months before that. So I really just want an update as to where we are. This has gone on too long. I think it's very, very important that we accredit addiction treatment, and if there is not an accreditation, that there is those facilities that are not accredited and quality are shut down.
Yes, and so through the chair, thank you to the member for the question. The work is currently underway on that regard. As you may have heard in the throne speech, we will be introducing legislation in the fall session to create that regulatory framework for addiction treatment centers. We are also working quite closely with the counseling therapists and through FACT Alberta around regulation for their profession as well. And tying that back to the estimates, there is some of the department work that is being undertaken to make sure that those frameworks are available, but that also we're working with providers in these fields to ensure that we are providing the best healthcare possible for Albertans.
Thank you. And just to be clear, I heard you say that also the counseling therapists, are you looking to create a college of counseling therapists? Is that?
Yes, that's the work that's being undertaken currently with the department. They're currently in the consultation with some of the related colleges on that matter.
Okay, thank you. That's very good news. I'm sure they'll be very happy to hear that. So I'd like to just move on then to in my last minute here, start a discussion on pharmacists. One of the specific concerns I've heard from pharmacists in my constituency is that pharmacists provide about 50% of the flu shots. Have you looked at the cost, potentially unintended consequences of the changes that have come as it relates to pharmacists' funding? Have you looked at the cost of AHS increasing flu shot clinics to make up for a potential and likely reduction of pharmacists who may not be finding that it's economically viable to continue providing that service?
Yeah, thank you very much, and I appreciate the question. We, through the amending agreement, it was identified that it was important to pharmacists that that they still be compensated at a rate that was tied with the highest in Canada. So that's what we've landed at with a $13 injection. So it's still going to be the highest in Canada, just won't be the highest by a 50% margin. And we don't anticipate pharmacists dropping this service, but we certainly are prepared to increase opportunities through public health for increased immunizations if that's required. We didn't reach capacity in public health administering flu shots last year, but we certainly have appreciate the flexibility in community through pharmacists being able to do that in their facilities as well. So if it comes to that, we will certainly respond, but at this rate, we're still tied with the highest in the country.
Thank you. At this point, I would like to call the agreed upon break. We will